Dave Edel, you're not the only Dave in the room. It's time for our Astria Health House Call segment, a weekly segment that, quite frankly, is just, I'm getting a lot of great feedback on it because we're learning so much. And you, as a spokesperson for Astria Health, are just a part of it as much as anyone. But the other Dave is Dr. Dave Atteberry, who is the guy you want to see in the area. And I know my wife, Lori, has known Dr. Atteberry for many years, and he is amazing and accepting new patients. So, Dave, meet Dave.
Hello, Dave.
I did the introduction.
You know, remember, you know who Terry Fader is? Does that name ring a bell?
Yeah, is he a ventriloquist?
Right, first winner of the talent show.
He's fantastic.
Dave Atteberry looks just like Terry Fader.
Or does Terry Fader look like Dave Atteberry?
Well, he's the impersonator, so he probably looks like Dave Atteberry.
Come to think of it, I've never seen them together in the same room at the same time.
They've always said I have a face for radio.
Oh, well.
You, it's a very pleasant face, and he's a great talent in the world of medicine. You're the Terry Fader of medicine. Neurosurgeon. Now, that sounds big time, even just to say it. You know, it's like brain surgeon, neurosurgeon. There's an awful lot of things that you have to know about and do, from the spine, the brain, the neck. Tell us a little bit about your journey into neurosurgery. Why that particular field, and what's it been like in a journey? You've been at it for a while now.
Sure. So I've been in the Yakima area for about 16 years practicing neurosurgery, and I came from the University of Pittsburgh. In my time here, I can say that the neurosurgery has always been an area of great interest for me because I was interested in how things work. The nervous system is really kind of an electrical system, and if you learn the wiring diagrams for humans, you can pretty much understand how things work or how they come together. So for me, my background was engineering, and so I went to college and became an engineer, and I guess you could say I wanted to be a rocket scientist. And then after I completed that mountaintop, I said, well, neurosurgery seems like a next great goal. So becoming a brain surgeon, and in this case a spine surgeon, in many ways just made a lot of sense to me. I was into big challenges. I was into understanding things, and therefore it lent itself very well to that.
Did you take apart the family radio and you were a kid and all that kind of stuff?
I certainly been to Radio Shack more than most people probably in their lifetime.
I love it.
Well, there's some real challenges when you're dealing with the spine and the brain and some of those things. Technology has become amazing. In your time with Astria, how does, I guess I should say, how are we doing technologically? I mean, the brain hasn't changed, but our ability to work with it, or spines, or discs, that sort of thing. I know that Astria has a great reputation for fusions and those kinds of things. How do you feel about the technology that's available in the Yakima Valley?
Yeah, I think that it's a very technically driven field, and therefore our technology has been catching up with our ideas for many years now. And so we've been adopting things like cervical disc replacements and disc technologies because we knew that the older ways of treating things were obviously going to change, and people are into preserving motion or keeping their movement as long as they can. So when we talk about different treatment options, oftentimes I serve as a counselor to patients to say, well, here's your options, and trying to explain them in a very easy to understand way is an important method toward easing them, because nobody wakes up Friday morning and says, I think I want to go meet a brain surgeon or meet a spine surgeon or a neurosurgeon today. That's not something that crosses their mind. So instead, we try and diffuse the situation by saying, well, listen, these are the things that we do, and we try and make it easy for them to understand, and that way they know that we can always address their issues in a way that is able to make it more simple, make them understand. And really, I serve as a counselor to my patients to make them understand their options.
Yeah.
Well, and when it's the ultimate option, when a fusion is called for, I mean, if there's just no other sort of relief available, That seems like a pretty major thing. I mean, you can get rid of the pain. How does that affect your mobility? Are you like stiff the rest of your life, or?
So certainly in fusion technologies, we're making people more stiff. That's why things like motion preservation have come about, where we're doing disc replacements and allowing them to preserve their motion. I think
Right.
that's an important distinction. I think 10, 15 years ago, we might have only had one option to give them. And now I give people a myriad of 3 and 4 and 5 options. We try and really tailor whatever the solution is to that person and their lifestyle. So
Sure.
what do they want to do? What do they want to accomplish? And then we cater ourselves to fitting into their goals.
Yeah, the counseling, I think, is a big element in what you're talking about, really, because after all, most people are going to talk to their GP and get a referral and see you. And I think a lot of times people even avoid checking out what their options might be because they think, well, I've dealt with this pain for so long, it's just going to be the way it is, or I'm kind of resigned myself to that fact. And they may not be aware of how many options are on the table, right?
Certainly. I mean, I would say that over 50% of the people that I see in my clinic do not get an operation. They simply come in and get information about what are their options.
Yeah.
And then for some of those individuals, it might be medication treatments. For others, it might be physical therapy. For others, it might be an injection type therapy. Surgery really becomes the last bastion of those that aren't amenable to the other options that we have available to them. And then we certainly have even a myriad of options within surgery to say, well, we have these simpler things that we do, and then we have these more complex things that we do. So we really try and tailor our solution to the patient right in front of us and really try and personalize their care.
Do you foresee a day then when we'll be able to connect nerves? The whole idea of a spinal break, and we become a paraplegic, quadriplegic. Do you see somewhere out in the future, maybe not in our lifetimes, but that being able to be regenerated or connected?
I think that neuroprosthesis, the topic of neuroprosthesis with chip implants and being able to put devices into people that help them. I mean, we all remember, for those of us that are old enough, the Bionic Man, and so
Right.
we're making people.
We can rebuild him.
Yes, exactly. It might be around $6 million, but nonetheless, that we all remember that. So with that said, I think that there is a time in the future where we will be doing neuroprosthesis and be doing implants that allow people to regain function. Maybe not, from the paraplegic to the walking, but certainly from there are already existing implants that are available to supplement people to make them, quote, bionic. So I think that future is not only science fiction, it's in reality. I see these devices being talked about, and right now in a research kind of standpoint, but I think in the near future they will be a reality.
Really incredible.
Well, $6 million back then would be a lot more today.
Yeah, I think it'd be a little pricier now.
You got to factor in inflation.
And can you imagine
doctor.
the copay? That would be terrible. We are chatting with Dr. Dave Atteberry, who is neurosurgeon, an MD, and one of the folks that is there to help you treat whatever condition, as you say, so many different conditions you might see them for with Astria Health.
Well, I just, as a guy who has a little bit of back issues and knows people who have a lot of back issues, I'm just really interested personally in this sort of thing, because it's a degenerative situation. I mean, nobody gets out with a perfect spine, do they?
No. I tell my patients all the time that I don't so much take care of diseases as I take care of natural processes of aging.
Exactly.
So we try and restore function for people so that they can regain their quality of life. So we really steer ourselves around that goal. Obviously, for many people, they're not looking to be in the Olympics. Instead, they're looking to garden in their backyard, or to walk around Costco and not have quite so much pain that they normally have, or even stand at their sink and do their dishes.
Right.
These are the simple sorts of solutions that in reality, I think these are more important to people, and these are their goals. And so we try and tailor ourselves around their goals.
Well, and Astria has the crew with the expertise. So if you are someone who suffers because of back issues and you've been dealing with your regular doc for some time, maybe it's time for a referral. Maybe you would be right for one of these alternate programs that would help and yet come short of fusion. I mean, I guess that's kind of as a last result. But if you can replace discs, or there's therapies that you can do, or whatever, let's get those checked out first. So talk to your doctor, and then go see the Terry Fader of neurosurgery at Astria, Dave Atteberry, MD. Doc, thanks for coming in, spending some time with us this morning. We appreciate it. And again, I just want to say to Jane, I'm loving these conversations where you get to see the docs. We talk about in person, get a little bit of their personality coming through. And my read on you, Dave, is that you want to help, and you want to be as least invasive in the process, but you want a positive outcome. And so it starts when you get your referral and come see you, right?
Absolutely, and I appreciate you guys putting out the word and just helping educate the public. I think that's the biggest role we have to play.
Yeah.
Find out more at astria.health. That's astria.health.